Hello, Dr. Becky here with Premier Chiropractic. In this video, I am going to address headaches in children. It's something I see often in my office, and a lot of times the kids will say, my head hurts, and parents kind of ignore them a little bit because, let's be honest, we've seen kids slip, trip, fall, get hurt, and they kind of get right back up and run along. But there's a lot of different things that could be going on, so it's really important when a child says, Mom, my head hurts, or at school I can't really focus because my head is hurting, just to kind of be aware and listen to them and kind of notice different things. Some big things I see with kids that get their head hurt or are having headaches is usually mood or behavioral issues, if we're talking about like the 3-4-year-old, kind of abnormal from their typical sassiness, if you will. But so anger or mood issues or frequent stomach aches can be really associated with headaches as well. But listen to what your children are saying. If they're saying it really hurts here or around here, it is likely that your child has a very common child headache, which would be called a cervicogenic or a tension type headache. And a lot of times we think, well, kids aren't stressed or they're not going to work, so they don't have tension or stress in their life causing these headaches, but they have different things that could be going on. A lot of times cervicogenic headaches or tension headaches can happen from a head injury. So if they fall maybe at the playground or they're just playing, doing their little kids sports and get a few injuries to the head, it can cause restriction in the neck. A lot of times the cervicogenic or tension headaches are coming from the neck up into the head. And I just want to show you a quick picture of what that looks like, because a lot of times the kid will say it hurts here or hurts here, but it's really stemming from the back of the neck. So I kind of want you to get an understanding of what that looks like. So I printed this off here. As you can see, your brainstem keeps going down here into these first cervical vertebra, and nerves come out of the spine here like this and come up into the head. So there's different areas, go to different places, but as you can see, a lot of things do stem right from the neck there. And what I find a lot of times in kids that say they have headaches is they have restriction in a lot of these areas here. So they can sometimes turn their head, they'll say, ow, it hurts when I turn it this way or look down, because they're putting more pressure than normal in that area, and it already has pressure and it's already kind of, the bone's stuck a little bit. It's not moving, there's not free range of motion there. So it's from there, or even already into the thoracic area. That can go up and cause headaches too. If you think about a child in school, they're sitting a lot of times like this, or they're holding a backpack down, stretching those nerves. So if there's something already being putting pressure there and then they're moving like that, it's going to cause more of that headache. Usually again in kids right here and then around here. So there's other kind of red flag signs. It's really important if your kid is saying that they have a headache to get checked different times a day, what's causing the headache. If it's not something that can be helped by a chiropractor, there's other things that we should be looking at, because if that kid has headaches over and over and over again as they get older into adulthood, it's almost like you're putting more layers onto the onion, right? So it's just going to get bigger and bigger, more of a problem and harder to fix the later they get in life. So again, if your child is saying they have headaches, if you're noticing kind of different behavioral things, it likely can be that they do have some sort of pain or something's going on. If you think about, sometimes we have to think about ourselves, right? So if I have a headache, I'm not in the best of mood, I am not maybe the friendliest, I kind of want to close myself off a little bit. So those are some signs that you can be looking for. If they're not, kids don't always say exactly what's going on. They're not going to say, oh yeah, and then it radiates this way and I feel it kind of pressure in my head. They use different words, but definitely look out for that. If your kids are saying they have headaches or you're kind of feeling like there's something going on, go ahead and give our office a call. I do a full assessment. We look at many different factors of what's going on in their life, not just necessarily this, but if it can't help, or if I don't think I can help, where are we sending them to next to make sure they're getting those headaches taken care of? Go ahead and give our office a call and I'd be more than happy to see them. Thank you.